Here is to seek the expert of
Greetings, everybody, and welcome to the St. Elizabeth Catholic General Hospital and Cardiac Center, Shisong. Today, we would be bringing to you a presentation you might not have had time to listen to in your lifetimes. And here we shall be listening to an expert from the institution in the person of Mr. Ngong Lawrence Mao, who will be telling us more on testicular torsion. You're welcome, sir.
Thank you very much, Mr. Ernest. Testicular torsion that we'll be hearing this morning is a serious health problem that affects men. And after living the experience, I decided to make it known to the whole world because it is written in the books, but it is not being said practically. So today we shall hear about testicular torsion.
So, what is testicular torsion?
Testicular torsion, it is the twisting of the spermatic cord that supplies blood to the testicles. And each time when the testicle rotates, it reduces blood flow into the testis. And it can bring about complication.
Good morning, sir. I am opportunity to be a student nurse and I've heard about this. I wish to ask if I was out there in the world and have not come across this, what could be the possible cause for me to avoid having this?
Thank you very much, lady. Yes, there are the causes of testicular torsion could come from an exercise or a vigorous exercise that can enable the movement of the testes, and by so doing, the spermatic cord is twisted and then reduces blood that flows into the testes.
He said, many people out there must be suffering from this disease condition, but they are not aware of it. So what are the possible signs and symptoms that will make someone know that he's suffering from testicular torsion?
Thank you very much. The age group that testicular torsion can occur is between 12 and 18 and men of all ages. If a child is playing somewhere in the quarter and they rush to you and say, Papa or Mama, I'm having pain in my testes, the first thing you have to look is to see whether there is swelling in the testes or whether there is some redness in the testes. And if that is done, if you see that, you get to understand that there is already a torsion. And immediately you seek the knowledge or the help of a medical practitioner. And sometimes when it is prolonged, it starts to present with fever, nausea, and vomiting. And sometimes if the child tells you that, or the man tells you that, as I'm urinating, I saw blood coming out first before my urine, then you know that it is already aggravated. Because testicular torsion should not last for more than 6 hours without health intervention.
So, how are the diagnoses done?
The diagnosis is done physically first by the person who come across the child or the man who has the testicular torsion, by examining the testes to see whether they are swollen or reddish. And in the hospital, there's an ultrasound that is done to be accurate that actually it is the testicular torsion.
So how can this condition be managed?
At home, if there's an expert, there can be what we call manual detorsion. Somebody who is expert can manipulate with the testes and return it. And that is to save the testes from being damaged. But the most important treatment is that this patient has to be rushed to the hospital for surgery, because it is during the surgery that the torsion can be corrected to prevent further occurrences. The first thing that the medical staff or the hospital staff should put in place in their mind is that testicular torsion is a medical emergency, and that each time that they come across the patient, everybody must be smart, from the gate man to the consultant, and from the consultant to the laboratory technician, then to the doctor, to the theater staff. Because we understand that if the duration is more than 6 hours, then we will have what we don't want to see. These testes can become necrosis. That's to say, the testes will be spoiled. No? If the testes don't spoil, it will be say they go move the testes, and that is what we don't want to hear here. Our management here, the hospital staff has to be very fast because they don't want to see that at the end of the day, somebody's testis is removed.
What could be the long-term effect of the testis being removed?
Thank you, gentlemen. The long-term effect, if the testis is removed, is that you are sterile. The man is sterile.
Meaning?
That means this Pekin no be born again, and that is very devastating. And that's the worst thing. You can testify with me that if your son is growing, to know that I had a problem with my testes, and my father and my mother wasted time, and the doctors wasted time, and this nurse wasted time, and my testes were removed. And now I'm a young man, I want to marry, and I cannot deliver. Then you can understand the depression. And if that child gets to know that it was my father, this child, I beg you, will hate the parent.
Sir, coming to that, how can you help the people? Is it that there's counseling, or what can you do to help the person recover quickly?
As soon as the surgery is performed, there is post-surgical care that is ensured that this patient recovered with by first class. That is to say, there should be no infection. And the patient has to be immobilized because mobility can cause, again, problems, and there will be hematoma. That means they will be bleeding. For people that they don't know, if they don't do operation, they come, this Pekin or pa, they get for put it for fine position where you go to shake. So that the place where they don't cut them for inside, cut again and it bleed. And very soon they go see where the test is be swollen. So for the first 48 hours, again for be fixed and the care is being given.
Si par exemple on arrive à retirer les testicules, comment pourra-t-on ramener l'enfant, faire comprendre l'enfant qu'il n'a plus de testicules?
Yes, we. Thank you, gentlemen, for your question. That is very much important for the counseling to take place. The counselor must journey, if it is in the child, there must be a counselor that journeys with this child spiritually and psychosocially, so that this child grows to understand that when I was this age, because of this, something happened and my testicles were removed. And that as I'm becoming into mature age, I can no longer be fruitful like a man. I can no longer put to bed. And that with God, everything is possible. I might have died, but the fact that God has allowed me to live, I should live and praise God in my situation.
Please, I wish to ask, can testis be transplanted?
I will be invited to the
You know, it's so nice to have such interventions. Can the testis be transplanted? If we look at the structure and we look at what is torsion, the process of it, okay, we look at it, we see that there is something that is linking the testis. That's the spermatic cord here, right? Yes. Have in mind that it's not only the testes that are functioning. It is a combination of the different organs. Now, if we are transplanting the testes, what becomes of the spermatic cord? So it is not just the matter of us transplanting the testes. It is the matter of reconstructing everything.
Very much, Mr. Lawrence. Now we hear now about the role played by the medical and the paramedical staff in giving care to those clients with testicular torsion.
Yes, the role played by medical staff in the hospital is that immediately the patient arrives at the gate man must be able to understand what is wrong with this patient. And if the gate man discovers that this patient is complaining of testicular pain, he rushes directly to the consultation room where the nurses receive this patient to take the vital signs and to assess the situation of the patient. Then they immediately called the doctor who come and confirm the issue. It could be done by ultrasound to be sure that it is testicular torsion. After this patient has been operated and is taken home, we need visitors. We need visitors. Visitors get to come for see this patient for house. For comfort, for make you me no say they don't do this work, but say he never die and he go be alive and he still be helpful into the society. So sometimes the visitors can come in and again aggravate his situation, because some of the visitors they will come now for come find out, is it true say they be operate this man, is it true that this is what was done, so that they can go and spread it. And if they spread his information outside, it's no good. Then the parents of this child, they have to journey too with the counselor with this child to grow as he's aging, to understand that I had a problem that is already a fixed problem and that I will live with this problem. If people them for house, they start now for the remind you about this thing, then they're going to make me be depressed, and that one we don't want it. That is the consequences of testicular torsion. If it goes to that, we don't want it. And this topic today, this talk where we here today, now for here we say if person get problem for a testis, me will rush for hospital so that me no end up for be say they go remove a testis. That one will not be good. So any man we don't hear this story today, and you feel help people them talk for men, talk for boys, talk for parents. May they begin watch their picking time when they play. Anytime when they talk about mama, I don't get pain, or if papa he woke up, he get pain for a testis, me no say he get to go for hospital. And in the Shisong Hospital, we have the experts that can help and reverse this problem. Thank you so much.
For screening and be alert, especially when we notice some pain in children. We also have to pass this information to them to know. I saw some young ladies were scared here when they mentioned about the guys being not being able to reproduce in the future, and I know how devastating it can be for young people to get married, and well, with that anticipation they had and it doesn't work out, and they have no spiritual counselor to actually work out with them. So please let us play our own role to educate the public, to check on even our children while at home, and see that we help them to avoid this kind of devastating situation. So thank you very much for being there. Thank you, our resource person. We hope that you'll be available next time to again navigate with us in the world of science, to know what we need to do, especially as men. We know they are shying away, they take care of others, but their own issues, they are hiding them. So women, help them sort it out so that they can also come to the hospital early. Next week, Thursday, we shall be gathered here to again continue with another interesting presentation on cervical cancer awareness. And our presenter, Mr. Shea Godfrey Utien, is already ready with a lot to share with us next week. So we'll be inviting us to invite other friends, invite other classmates, and make it a duty to be here next week so that we can continue to capacitate ourselves as far as awareness creation is concerned. This month of January is the cervical cancer Awareness Month, and we need to blow the trumpet so that people are screened on time to prevent cancer. So thank you very much.